Okay, well, thank you so much, everyone, for joining us here today. For those of you who don't know who I am, my name is Dr. Elisa Peavy. I'm a family medicine physician. It looks like we might have a new person maybe joining us, but I actually left, I guess, traditional medicine last year because I saw things at that time that for me didn't really jive with me ethically. They tried to change my contracts to essentially take people's freedoms, medical freedoms away, and have me earn money based on them getting whatever preventative measures the health system felt was necessary and important for them. And that's really why I'm here today, because I think the crux of this issue truly is about our health and our medical freedoms. And over the last 18 months, we've had this situation that has really turned our world upside down. It's changed everything that we know about life and the way that we're living and what we're doing. It's completely different. It's completely new. And all of us are still trying to figure it all out. But of course, within that, there are a lot of concerns with various therapies that are being, I'm sorry, not therapies. There are concerns about one particular therapy that is being touted as the only thing that can save us, the only thing that can get us back to normal. I've spoken and I've said this many, many, many times, but I really want to iterate it because we talk about the risks versus the benefits. And this particular therapy, we know without a doubt has its side effects and deaths, actually, major adverse effects associated with it. And the actual bug itself has caused deaths also. Right. So what we want to do is actually find ways where we're hopefully not having either from either getting the bug itself or from this in the arm. If we can find things which we know that we have out there, there's so many doctors who have different options out there, and we're saving lives on both sides. Why that, to me, that makes sense. And the other thing that I haven't really understood is that, we're hearing reports that everything shows, especially in mainstream news, that everything is showing people who are sick are the ones who have not gotten this therapy. The ones who are coming into the hospitals and being admitted are ones that haven't gotten this therapy. And then, of course, the narrative is that the ones who haven't gotten this therapy are the ones responsible for all these other people getting sick. Well, the evidence doesn't show that, and it's being kept. It's being suppressed. But we actually have frontline workers who've been behind the scenes. They've been taking care of these patients. They've been taking care of those who've been sick, and they're the ones who are really seeing what's going on. And they're coming to me in droves with story after story after story that is not showing or not telling me that the majority of these people who are sick are the ones who haven't gotten the therapy. In fact, it's just the opposite. And so today I'm here with 3 other people who have stories. They all work in the health system in one way or the other. And they're going to share their stories with you today in terms of what they've seen and injuries that they've seen and other things that just don't add up and aren't what the mainstream media would like for you to think, would like for you to know. So we're going to start with Shelby. And if you just kind of want to introduce yourself and tell us, what you do. And
my name is Shelby. I work as a patient transporter, meaning I transfer patients to and from the ER, the floors, imaging procedures. So I cover the entire hospital all day. So I'm always in and out talking with people and nurses and all kinds of staff. So it gives me a really good perspective on what's going on throughout the entire hospital and trends and stuff. Um, I mean, start off, it's completely opposite of what's being portrayed, with special C numbers, sickness numbers, and staffing ratios. Even from the beginning, our numbers of C patients were off. I mean, at least for the last 3-4 months, we've steadily held only 5 to 8 patients at a time, and not the numbers that there, were in outbreaks and everyone has the bug. It's 5 to 8 patients daily.
And when you say 7 to 8 patients at a time, are you talking about those patients have this
Mhm.
virus? Okay, so maximum that you don't really have many more than that necessarily.
That doesn't mean that that's a new number that we're getting every day. That's just currently at this time, we have this many patients
Gotcha.
that are positive.
Okay.
It's not the tens or hundreds or whatever you're seeing. And also, I've seen a lot of trends with the rule outs. I work throughout the ER a lot. We're always doing scans and admits and discharges and stuff like that. And at the beginning of this, every single patient I transported was on a rule out. They were testing literally everyone. And then starting probably, early this spring, maybe late winter, those numbers started dwindling and became very few that were being tested for rule out. It was just, people with obvious, shortness of breath, obvious respiratory distress that were being tested. And all the way up until probably about the beginning of summer. And then I started noticing as they started pushing this variant, as well as the jab more so on the public, that these numbers started rising. These rule out numbers, people that came in for abdominal pain are being tested for a rule out. People that, come in with, all kinds of stuff totally not related. They're just coming to the ER for a normal sickness and they're being tested as a rule out. So then that raises our numbers. So there's that. We also,
So did they stop kind of testing for a little? They took not a hiatus, but they weren't doing it near as aggressively.
They were really testing obvious, things to make you believe they, yes, absolutely could. But then they stopped for a little bit. And then, as soon as this new variant being pushed and numbers were rising, and we have to be really, really careful because it's super contagious, all of a sudden, everyone's a rule out now. With these PCR tests is what they're doing on the too.
And guess what happens when you start looking for something when the person's not really presenting with it? You're going to start coming up with a lot more cases. Yep.
Exactly.
But they weren't being admitted because they weren't needing,
exactly,
for illness, for that specific illness. Yeah.
Yeah, they weren't, most of them, were discharged and sent home with whatever, they need an antibiotic, excuse me, or something like that. And then they were sent home. But when you raise those numbers, that means money. And that means attention for those.
Has anyone spoken to you about those numbers, or has anyone spoken with you about all of a sudden why are we testing on people that aren't coming in for symptoms that would be suggestive of this illness?
I don't have contact with much more upper leadership than nurses. I mean, the highest I get up to is nurses talking to staff like that. So, talking to any sort of administration or even managers, leaders just isn't part of my scope. I just don't see them in what I do. So I haven't talked to any of them about that. And,
sure,
nurses probably aren't informed as much either.
Do you talk to your colleagues at all, or any of them, about how the numbers don't really seem to add up in terms of what they're telling people?
My department's made up of mostly college students, very young people, and There's only one other person in my department that I know of that is kind of looking into this and saying, hey, this is weird, this is wrong. So for me in my department, I'm very much an outcast. I bring up anything about it, and everyone loses it and says, well, if you just knew, if you just knew, if you just did this. So it's kind of hard to talk to my colleagues about it. Um, you know, so there's
Yeah,
that.
they're not, does it seem like the conversation isn't as open, that you try to
Oh
bring it
yeah,
up and it's like,
yeah,
there's not really an answer. It's just kind of a don't talk
mhm,
about it.
exactly. Yeah, it's
Okay.
me versus the 10 other people in the room.
Mhm.
And so, that happens. And then my supervisor walks out and we're like, well, we're done talking about this,
Ah, gotcha. Okay. Okay. So it's kind of shut down then, even if you could try
Mhm.
to bring it up, it's just really not allowed to continue.
Yeah,
That's too bad. Okay.
yeah, that. And then
Um,
also seeing like staffing ratios. I know hospitals are released saying, they're not worried about staffing issues. And I mean, right now in the ER, so a safe patient ratio, right, for a nurse or CNA is 4. Right now, at least CNAs are seeing 8 to 10 to sometimes 15 patients, the ratio. Our nurses on the floors are having, 6, 7 patients at a time instead of 4. I mean, I've seen ICU nurses handling 3 unstable patients at a time instead of the 1. So,
and because they're understaffed, or because
because they're understaffed,
understaffed. Okay. Okay.
they have no staff.
So it's not that there's not beds available, it's just that there's not staffing to
Mm,
take care of all of the
Yeah,
people.
we, yes, we do have a very full hospital, but it's not because of COVID. It's because of our ER is overrun
Application.
by patients who haven't come in, and it's overrun by surgeries that we're still trying to catch up on after we canceled them for a year. Keep scheduling all these surgeries. The ER is overrun by a year and a half of no treatment. People are finally now coming in because they're good now because they got the jabs. They're not afraid. So now everybody's coming in. And so it makes it look like our hospitals are overrun. And currently, yes, they are, but that's because we have no staff. We have an empty unit of, I think there's like 15, 16 beds in there that just stays shut and locked down because we don't have staff to run it.
Now, did you see, did they let a lot of people go from your hospital last year?
No,
No, okay,
it was not one of those hospitals. No.
okay, okay. Because and you're a critical care hospital, so you were receiving a lot of those transfers, right? For the, okay, okay. Well, thank you so much for sharing everything that you've witnessed and kind of what you've experienced. It's very telling, especially the not testing to suddenly testing everyone again.
Yeah.
Why
Mhm.
all of a sudden they would do that on people who, why are we testing asymptomatic people? We don't need to
Exactly.
be doing that.
Exactly that.
Really,
And our hospital is overrun. We're technically full, but it's normal sickness.
yeah,
It's not the bug, it's sickness.
not what they're saying. Okay. All right. Anything else? Any last thoughts?
Um, from my perspective, not really. I don't have much, contact with actual positive patients, or I don't see I'm not a caregiver to see firsthand reactions, but I can see trends and I can see ratios. Um, so
You've got the numbers, you've got the data. Yeah, it's good. All right. Heather.
Hi.
Hi there.
I still haven't figured out how to turn it on, but maybe by the next call I'll figure it out.
That's okay.
But you guys can all hear me?
Yes, yes, we can.
Okay. Yeah, I started working at an assisted living center in just sometime right after COVID. As a matter of fact, when the whole state shut down is when the day that I started working at an assisted living center. So I didn't even know how our kitchen ran before COVID. I just walked into a COVID kitchen. You know what I mean? How it ran for that. So everyone it was locked down in their rooms. So I was in the highest risk of people. I was in the elderly community. So we were, you know, always under high, gloves, masks, everything had to be spotless, spick and span. Well, regardless of all that, our residents were getting sick. They were getting COVID, and they literally got, they would get taken out of our facility, and then they would come back. They would come back into our community, and then it seemed like another round of people would get it. During this whole time, all of us are getting our noses swabbed relentlessly. Every week we would get a nose swab. And I mean, I still have sores in my nose from the getting swabbed so much, and it was painful. Anyway, I'm sure you guys all know that whole story. But uh but the residents they were all coming out of it. Once it hit our memory care, our dementia unit, that's when it seemed like we were having some problems with people dying. But these people were at high levels of other things aside from dementia, and getting a sickness like this, it almost indubitably was going to kill a 93 to 100-year-old person. And it did. And that was the highest amount of people that we saw in our facility that died. We had a couple that were in the regular part that died, but they were high respiratory. They were already on high amounts of oxygen. So they were already compromised. But for the most part, even some of our very elderliest, sickest residents came right through it. No problem. Just were fine. Some of them, it didn't seem like they recovered better. Well, it wasn't long after that they were all made to be given the shot, the thing. And a lot of them didn't want it. I would discuss with them because we knew it was planned. It was all over. I mean, they made a big deal out of it. Balloons and parties and cakes and cupcakes and cookies and incentives and all kinds of things for these residents. And some of them didn't care. They could care less. They thought it was going to be the magic. And they were happy to have it because they were going to open back up. They were lonely and sad, and most of them just missed their family. And so they took it freely, but some of them fought it, and they were angry, and they were, I mean, livid. But it was important that we had 100% compliance on it.
Wow.
Because in order to get that PPE, you guys know about all the PPEs, right? All those, it sounds like our masks that we use. Well, these were relief funds for all the hospitals, and they were in the millions. Anyway, I have no idea what our facility got, but it was quite, I'm sure, a lot. The PPEs were immense. Anyway.
I just want to make sure. So the PPE is money that was given if you have a certain number of people from the facility that received the inoculation.
Yep. Compliance to it, yes.
Yeah.
And all of them got it. Every single one of them, whether they had it or not. And they all did. Remember, it came through. It's kind of spread through us like wildfire. I don't think anyone was really spared, but they all got it. And some of them were just, one of them immediately went to emergency room, wound up dying 2 weeks later. Another one, completely normal, sane, loved talking to her because she was so wise. She was also a nurse in her younger years. So we used to talk a lot. She's just a beautiful woman. Anyway, insane right after getting it. Normal to climbing, literally climbing the walls. She's dead now. She died. But she went insane. She was climbing the walls, and that was definitely related. It had to have been. There was no way around it. Anyway, she's died since. But
what was said after she passed? Like, did anyone at the nursing home, either nurses or other staff, admin, like, was it?
Well,
discuss.
yeah, we would all talk. Okay, so I am the boisterous kitchen. I am in the middle of the place. So everyone comes in my kitchen and we all talk, and everyone knows who I am and if they're going to get my feelings about everything. And so I have nicely created a bunch of antis in there, like people who are just not going to do it for a while, you know? So my non-compliance has caused a lot of because even there was incentives for us employees to get it.
Yeah, I
And
actually, I don't have any verification for this, but I'm pretty certain it's probably happening if it hasn't already. I mean, the reason why I left my job is because they wanted me to force like a certain percentage of my patients to have all of these different, uh, preventative
yeah,
options.
well,
What
listen, when
what
it
they
comes
wanted me
down
to
to it,
do.
it all comes down to money.
Right, and that was the thing, and they
Yeah.
wanted us to get the percentage because then they weren't going to get paid. So it really truly was just all about money and them getting the money. And and it doesn't matter if anyone feels that they've been bullied or forced or coerced. As long as we get that 80% so we can get paid. And it is an exorbitant amount of money
Oh
above and
man.
beyond.
I know, I know. I happen to know a woman who knows way more, and she happens to tell me more things than if she even knew she was telling me. But she's part of the problem, but she knows the numbers of all the problem, and so she tells me anyway. But long story short, a lot of the employees complied, and they got their $100 on their check, and I just said to a couple of them, I hope it was worth it. I hope, may God bless it and let it do exactly what it not supposed to do, I suppose. I don't know. Anyway,
Is
to make a
everyone
long story
okay?
short, this is making our elderly sicker. Whatever they had is now they're just getting very old very fast. None of them have felt good since they have gotten it. None of them. They have no energy. I have watched their personalities go from fun, carefree, and a lot of it is convoluted because you're not sure if it's because they miss life. They miss family, they miss events, they open up, they shut down, then they opened up again. They just didn't know what to do. So I've seen it from that point of view, this elderly assisted living point of view, and it's been quite sad because a lot of them have died not seeing their family in the end,
Yeah. It's hard
Um,
to say, how much, is related to the isolation and all of that. I know
it
there's a
is.
huge part of that. And honestly, that's one of the things I've been upset with too, in terms of how we went about doing that, because as humans, we thrive on touch, right? I mean, babies, we know that babies born, if they're not touched, they actually have severe psychological problems and attachment issues and all sorts of other things. They actually, their brains don't develop the right way. And the same is for our elderly and just people in general. We need to be
Oh
touched and
boy.
we need to be loved. And for a lot of them, they've been without that for 18 months. And that's causing problems. We're not just not looking at, the therapy, but also all the other stuff that was done that is creating so much
Oh
anxiety and
man.
difficulty and loneliness and isolation for these people. You know,
Yes.
it's hard all around. Of course, we want to protect and save, but how can you protect and save someone when you can't even go and visit them and be near them? How is that really saving them? Because they don't really understand a lot of them. They're at a point in their life that they don't get that, and they just know that they're lonely. So
Yes. So the bottom line is what we did have the facility that was supposed to be for the overflow for the whole Magic Valley. We were supposedly getting people all the way from Utah to from all Idaho. Okay, we were supposed to fill this unit, this extra unit that we have on our facility campus. And the highest it ever got was 26 people, and 10 of them were our own that we hadn't brought back over because we were kind of lazy. They were lazy not getting our residents who were supposed to be back in there back over to our facility. So the numbers were never big. There was never any overflow, crowding. That the numbers are lies.
okay.
All of them were lies. And if these people died, it was because they were old and DNR and dementia, which, I mean, come on, put something like that in their bodies. What the heck? Have anything go wrong with their bodies? They don't even know what to do with it. Their bodies have forgotten. You know what I mean?
For something that's experimental, you know, at
Yeah.
this point still, yeah.
Yeah.
Well, Heather, thank you so much for
Mhm.
sharing and what you've experienced and everything else. I really, really appreciate your thoughts. Thank you.
Mhm.
Kristen, are you ready?
Yes, I'm here. Sorry.
No, no worries.
All right.
So
Okay, so
Kristen,
my name is Christina. Yeah, my name is Christina. I've been working on the front line since January of 2020 here in Southern California. And sadly, I've seen a lot of medical mismanagement of this virus, and it's very politicized. I've always been
you're
kind
a
of open.
nurse, is that correct?
Yes, I'm a registered nurse for,
And I-
in a step-down unit.
Okay, all
Yeah.
right, cool.
So when COVID first hit, initially, we were designated the COVID unit. We weren't, when the initial lockdown happened, we weren't as overcrowded and you know, panicking and running for our lives as the media made it seem. And I kind of questioned, I was like, why would they be lying, you know, to the public about this virus when it's not really overtaking our hospitals right now, but they're kind of portraying it as that. So that happened. I do remember having a few elderly patients get discharged to a SNF that were positive for COVID. And I didn't really understand why at the time. Since our hospitals weren't that crowded, isn't it safer to keep an elderly positive COVID patient at the hospital, pretty much under quarantine away from the other elderly patients? But for some reason, my hospital was pushing to get him out. Well, come to find out later, Newsom was one of the governors who sent the elderly patients back into the nursing homes. Okay. Then one of the biggest medical mismanagements, I think, is stopping patients from getting early treatment of this virus. Pretty much the hospitals are just telling patients, oh, you're positive for COVID, go home, rest, and just come back when your symptoms are so bad, now you have to be admitted to the hospital. And I think that's a really big medical mismanagement on the hospital's part, because now we know with early treatment using certain medications, HCQ, zinc, quercetin, ivermectin, all of these medications can actually treat and cure COVID with early enough administration. And even though we're a year and a half later, we have patients come into the hospital that are positive and the doctors tell them, no, sorry, there's studies that prove that that actually doesn't work. Remdesivir is the only medication we're giving, and that's just false. The way that these doctors are handling these patients, they're not upholding their oath, and I wouldn't be either if we knew that something was better for our patients. And it's time for us to speak up and gather together. So I think that's why it's time to take a stand now and really fight for our medical freedom.
Yeah.
Another big thing, yeah. So like another big thing that happened in California, and it was the week before Gavin Newsom initiated the second lockdown. We started receiving patients from Mexico that were positive for COVID and taking up our ICU beds and our step-down beds. All the beds in the hospital, for some reason, were being taken up by positive. What was that?
When was this?
This was the week before Gavin Newsom initiated his second lockdown. The week before he did this, all these patients, and I was communicating with other nurses that work at different hospitals here in Southern California. Not only did I take care of a patient from Mexico myself, but I had multiple other nurses come out and tell me the same thing. So what is happening when patients from other countries, God bless them, they need care too, but they're taking up resources from Americans, and they're taking up hospital beds that could have been used for, I don't know, one of my family members, one of yours. The point stands that, you know, this has not been handled properly at all. And for some reason, they came over here under whose authority, I don't know. But yeah, that's one of the biggest things.
They transferred them from Mexico to California to back.
Well, see, this is a little bit of a gray area. There is some nurses who work at a very large hospital over here that said, yes, that did happen in a small number. But again, I didn't really see that for myself, so I can't say that for sure. All I know is that they were positive in Mexico and they ended up in Southern California taking up hospital beds.
And taking
Yeah.
up numbers, right? They look
Right.
like
Yeah.
numbers
Oh,
of
yeah. So
patients.
that's how,
Mhm.
right. So that's how Newsom was able to kind of force us to go on lockdown again.
Yeah.
It was crazy.
Wow.
I felt like Alice in Wonderland. I feel like that still, that here we are a year and a half later, and now instead of being called a healthcare hero, I'm being called a terrorist. I'm being called an anti-vaxxer, that I should get out of my profession because I don't believe in science. I mean, what scares me is how cruel people are getting with my medical freedom and everyone else's medical freedom. It should be a choice. We should never have to be forced by the government to give up our bodily autonomy. Once we give that up, that's it.
Yeah, exactly. You're 100% correct, and it's complete and utter BS that they keep touting and saying the same thing. We're following the science. No, you're not. The science hasn't concluded yet. You are truly the science. You're the evidence-based medicine of what's going to happen when we have conclusions next year. And you try to have a conversation sometimes, and that's all you hear is we're following the science. Well, that's not even an answer. Why can't you actually look at the data that we're providing and talk at that instead of telling me that you're following the science? That's crap.
That's what was happening in my office. That's why I never bring it up, because everyone goes, well, why are you working in healthcare? Why do you have goals to be a nurse if you can't even believe science?
Right. And it's a
and to me,
bully
that's so
tactic.
disgusting.
Yes, it is disgusting, Christina. You're exactly correct. It's, and we talk about, I'm sure most people have now heard about the Nuremberg, trials, and what those were following World War II when Germany was testing on people in such a horrific way. They realized that they needed to come up with guidelines and principles and laws essentially on how we can test on subjects. Well, I didn't write down, there's 10 different rules, but one is you need full consent from the person themselves. How is a forced mandate like a consent from the person themselves? You need to have fruitful results, like a beneficial result. We don't know if we have beneficial results yet. And in fact, from, Shelby, what you're seeing, and I think Christina, you had mentioned it as well, that, the people that are in there have already, most of them, or a higher percentage, have already been inoculated, and they're the ones who seem to be getting sick and who are coming in again, right? So I don't see the benefit from this. We most certainly know. Yeah, I mean, we know that it has, that people died from it. We know that people from both the actual and the inoculation. And like you said, we have therapies that work, that doctors are telling people over and over again that they can't get. I cannot tell you how many people have come to me, sent me messages. The doctor told me there was nothing they could do. There was nothing I could take there. I mean, it was one after another, after another, after another. And to say that that is disappointing in my specialty it's so disappointing. It's like the most disappointing thing to hear as a physician, that we're not even looking at other options, that we're just blindly saying, well, there's nothing else. They're telling me there's nothing else out there.
Yep.
Why won't you at least try something that we know the side effect profile for, at the very least, just give it a try, right? We know it's not going to cause death unless we literally prescribe, an exorbitant amount, which we already know not to do. So why don't we try it? I'm just baffled to me,
Absolutely.
Yeah.
Absolutely. We should have all gathered together during this pandemic, politics aside, and been like, what can we do? What are the medications? Let's try it here. Let's try it there in the correct setting, the correct time, so we could be able to save some lives. But instead, no. The doctors in my hospital were like, hydroxychloroquine, that's a conspiracy theory. That's what they would say to me.
I know.
And I was
it's
like, but
crazy.
if that was your grandmother in the bed, wouldn't you want to try anything possible to try to save her life? I don't understand how the healthcare industry became so political until COVID-19 hit us.
Right, right. I mean, we use off-label medications all the time, especially
Right.
ones that were fairly safe, you know, and to be, I mean,
Yeah.
docs have lost their licenses for trying to prescribe them. I mean, others have opened their own compound pharmacy so they didn't have to be mandated or not allowed to do what they want to through the other pharmacies. I mean, there's all sorts of stories in terms of what people have done, but it's horrific that they're losing their licenses for trying to help someone get better, and basically condemning and bullying, you know, people, or making them feel like they're doing something wrong if they're not just willing to go and get, you know, a quick stick in the arm because they're saying
Yeah.
they should. So.
Well, you know, I want you guys to know the whole world is watching Idaho, because I don't think that they're pushing as hard and everywhere else as they are here. It seems like they're really attacking this, you know, pretty conservative state, you know, and I figure
Yeah.
if they can get you guys here, they got everybody, you know what I mean?
Exactly.
Yep, that's it.
exactly it.
Once Idaho falls, that's it.
Yeah, I know I'm not backing down. Like, I'm gonna continue to try and bring stories like yours to the forefront for people to see as many as possible and get it out there for everyone to see. Because I feel like the more that people can actually watch, those of you who know what's actually going on, maybe that's going to make the difference for a lot of them. You know, they're going to see it and like, oh my gosh, they're refuting over and over again what is being stated in mainstream. And I know we can make a difference here. I really,
That's
really
right.
do. We have to get enough people willing to band together. Another idea I actually had this morning was if people have a lawyer make up a contract and if they're going to insist on mandates for those people who are okay with I guess getting it or taking that contract to them and saying, hey, you have to sign this that gives you basically all liability if something happens to me. So I will if you do this. You take all liability,
Yeah.
all responsibility, there you go. No one's going to do that. They're going to all back down. But at least if people band together and say, okay, you want to try and give me a contract, you know, saying that whatever's, or not a contract, but you have to sign something. I think releasing liability, I would turn it around, you know, no, you're going to be liable if something happens to me. We know there's deaths. We know there's injuries. We know there's disabilities. I'm going to interview some lady coming up here in a couple of days. I think she's blind in one eye and has some paralysis from this inoculation.
Yep.
For the rest of her
Yeah,
life,
that's her story.
she's subjected to this. So it's not okay. And someone should be liable. Someone should be liable.
Right.
Government, unfortunately, is not they're not taking these seriously enough, and they also are not looking at enough cases to even make a dent in truly what has happened to the numbers of people.
At this
You know
point,
what?
they
This is
force
kind of
me to
piggyback.
become part of the
Go ahead.
control group. We are the control group now. You know what I mean?
Mhm.
There is no A and B. It's all A except for the ones who aren't. You know what I mean? At this point. So we are the only test that is, you know, to see.
Yeah. I do suspect that they have some placebos out there. I don't know why, and I don't have any proof. Like this is just me, my intuitive feeling on it is that they did not give everyone the actual thing, that there are some placebo, but
I don't know.
I don't know for sure.
I
But,
don't
It
know.
definitely could be, and sadly, we probably won't have that answer for a very long time.
mhm.
But just the scariest part that's going on to me right now is the suppression of the amount of adverse reactions that patients are having in the hospital. I took care of a woman in her 30s, just had a baby, got the J&J, and that same day she had a neurological problem and came to the hospital. And I asked her, I was like, do you think this is directly related to the shot? And she said, yes, I'm never getting any vaccine again in my life. And she didn't get counted. I can name 10 other situations where people are coming in with heart attacks, pulmonary embolisms, severe migraines to the point where they can't eat, they can't have the lights on, nothing. And none of these are being recorded as adverse reactions. So when I listen to the CDC, when they say, oh, what is it at now? Like 4,000 adverse reactions or the deaths right now that VAERS is reporting on for
12,000
America.
deaths. 12,000,
Yeah.
what they're reporting, and almost 500,000 adverse effects that's included in all of that. Almost 500,000.
I checked this morning.
Based on what I've seen at the
512
hospital, I think it's double, if not triple. That's not an accurate number. And that's what's scares me, that people are using that number and saying, oh, see, it's not that bad.
Yeah.
We'll come to the hospital. We'll come, do a round with me, and I'll show you that that's not accurate.
And even people that don't come to the hospital will just experience minor things at home. We're not going to go and report
Right.
this. People that have missed a period, they don't go and report this. People that have headaches, they don't go and report this. People that get dizzy every once in a while now, or nauseous, or whatever it is. Those are also not, that's just not, it's not just people who are hospitalized too. It's everyone at home that it's not severe enough to bring them to the hospital.
Mhm.
Yeah.
But they're still experiencing what they didn't experience before they got the shot.
Yep. Yeah. I mean, I could tell you story after story after story. But I mean, one lady that I know, she's 75-year-old, works out 5 days a week, does Zumba and other exercise classes, very healthy, super lean, eats well. And ever since she's had it, she's like, I'm just tired all the time. She goes, I just don't feel good. Something's off. But she can't put her finger on it. She doesn't have anything definitive, but she feels exhausted. And of course, she's 75. So what's going to happen when she goes to see her physician? Well, she's probably going to be told that, well, you're 75, and it's kind of to be expected, and that's about what it is. But it's not, and she knows that it changed, that it's different, that all of a sudden it was over, almost overnight is what it felt like to her. But there are so many stories like that. Even in the support groups of people who have gotten them, there's support groups that everyone in there, had received it. And I see it one after another after another. My doc's not believing me. I've had migraines now, or headaches, for the last 6 weeks, ever since I got it. I've had this, I've had the fatigue. I just don't feel right. I'm ready. I'm so miserable. I mean, it just keeps going. It keeps going. And those ones are obviously ones that are not documented, So yeah, what you guys are doing is very necessary. So thank you, all of you, really and truly. Your voices are important, and I appreciate you so much. Right.
Thank you.
Thanks for organizing
For
this.
putting it together.
Yes.
Yeah.
Yeah, I might reach out again, for other things, but we're going to keep this going. So, and also, of course, share with any and everyone. If you have email lists or friends and family, the more that this can go places and people can see, the better we have of really reaching and hopefully making a bigger impact. So,
All right,
Thank you.
all right.
Thank you so much.
Yeah, have a wonderful evening. Thank you again.
Thank you.
Bye-bye.
Take care. Bye-bye.